Keep our campus smoke-free. Health consequences of smoking. Smoking causes cancer. Smoking causes cardiovascular diseases. Smoking causes respiratory diseases. Smoking harms reproduction, and smoking affects your overall health. Cancer was among the first diseases found to be caused by smoking. Your risk for cancer increases with the number of cigarettes you smoke and the number of years you smoke. Cancer is the second leading cause of death in the United States. Smoking causes cardiovascular diseases. Cigarette smoke damages the cell lining, your blood vessels, and heart. Coronary heart disease is the leading cause of death in the United States. You are 4 times more likely to die of coronary heart disease if you smoke. Smoking causes strokes. Smoking causes respiratory diseases. Smoking leads to injured lung tissue. Injury to tissue leads to COPD, chronic obstructive disorder. COPD makes people not have enough air because air sacs are swollen. Smokers have more upper respiratory illnesses than non-smokers. Smoking decreases your immune system because it makes antioxidants less effective. Smoking harms reproduction. Smoking increases difficulty in getting pregnant. It can cause placenta previa, placental abruption, and water to break too early. Women who smoke have more complications during pregnancy, including low birth weight, infants often less than 5.5 pounds, stillbirth, and infant mortality. Babies exposed to secondhand smoke are doubly at risk for sudden infant death syndrome. Health benefits of smoking cessation. Stroke risk is reduced to that of a person who never smoked after 5 to 15 years of not smoking. Cancer of the mouth, throat, and esophagus risk are halved 5 years after quitting. Cancer of the larynx risk is reduced after quitting. And coronary heart disease risk is cut by half 1 year after quitting and is nearly the same as someone who never smoked 15 years after quitting. Chronic obstructive pulmonary disease risk of death is reduced after you quit. And lung cancer risk drops by as much as half 10 years after quitting. Ulcer risks drop after quitting. Benefits of smoking cessation continue. Bladder cancer risk is halved a few years after quitting. Peripheral artery disease goes down after quitting. Cervical cancer reduced a few years after quitting. Low birth weight baby's risk drops to normal if you quit before pregnancy or during your first trimester. The impact of a smoke-free environment for all employees on wellness. Secondhand smoke causes sick employees. Non-smokers inhaling secondhand smoke are greatly affected and have a 20% higher mortality rate than people not exposed to it. It lowers the cost of business. When there is no smoking in a workplace, people are healthier. In fact, after quitting, smokers' body can become as healthy as non-smokers after 15 years. Smoke-related illnesses cost over $3,000 a year per smoker, which greatly increases the cost of healthcare.